Somebody asked about what the potential role of vitreopapillary traction is in the development of non-arteritic anterior ischemic optic neuropathy. Now, this theory has some merit because it is biologically plausible that traction on the optic nerve head, so here's the optic nerve, and the vitreous pulling up like suspenders on the nerve could cause swelling. And that swelling could lead to a cascade of ischemia in a small crowded optic nerve that could lead to further ischemia, which leads to further swelling, which causes more ischemia, and a sort of compartment syndrome in a small crowded optic nerve triggered by a traction band on the disc head. We see the same type of traction in the macula, which we call vitreomacular traction. And so the same phenomenon of traction from the vitreous on the macula can occur at the papilla, which we call vitreopapillary traction. It's not known what causes non-arteritic anterior ischemic optic neuropathy. Even though we call it ischemic, there's never been any thrombus demonstrated in NAION. It's not an embolic disease. We don't actually do carotid Dopplers or echoes or EKGs or anything really for NAION on the emboli side. It's thought to be a small vessel ischemic disease. However, VPT alone probably cannot explain all of NAION. Number one, we have OCTs through NAION patients, and not everybody has VPT. And number two, there are clearly risk factors for NAION that have nothing to do with VPT, like diabetes, high cholesterol, hypertension, post-surgical cases. And so VPT might represent a subset of some patients of NAION, but I don't think that VPT by itself can explain all of NAION.